Welcome to our NCLEX Practice Test. This test has 75 questions on topics you'll see in the real exam. These questions will help you better understand the concepts that will be tested on the exam. Let's get started. 1. The atlas and the axis, A, are found in the vertebrae. B, can be described as being cervical. C, are the first two bones that form the column for the spine on the superior aspect. D, all of the above. Correct answer, D, all of the above. The atlas and the axis are the first two cervical vertebrae and are designated C1 and C2. The atlas, C1, forms support for the skull, and the axis, C2, allows for rotation of the skull. 2. The body system that functions to maintain fluid balance, support immunity, and contains the spleen is the A, lymphatic system. B, digestive system. C, urinary system. D, reproductive system. Correct answer, A, lymphatic system. The lymphatic system functions both for protection from foreign invaders and for fluid balance. In addition to the spleen, the lymphatic system also includes the tonsils, thymus, lymph nodes, and lymph vessels. 3. Mr. and Mrs. K have just adopted a newborn infant and are preparing to take him home from the hospital for the first time. Which safety measure is most appropriate for the clients in this situation? A. Turn the handles of pans on the stove inward. B. Set up a baby gate at the top of the stairs. C. Cover electrical outlets with child-proof plugs. D. Install an approved car seat that is facing backward in the back seat. Correct answer, D. Install an approved car seat that is facing backward in the back seat. Parents of newborn infants should use an approved car seat that has been installed facing backward in the back seat of the car. Securing infants in car seats, even from the first ride home from the hospital, promotes safety while transporting. While safety measures at home such as baby gates or outlet covers are important, they are not priority safety measures until the baby is old enough to be mobile. 4. A nurse is caring for newborn infants in a nursery when a man enters the area to take his baby back to the room. The man does not have an identification bracelet and the nurse does not recognize him. What is the next action of the nurse? A. Call security and ask them to escort the man out of the nursery. B. Ask the man to wait and check the infant's chart. C. Ask the man to return to his room and bring an identification band. D. Allow the man to take the baby to his room. Correct answer, C. Ask the man to return to his room and bring an identification band. The safety of infants in newborn nurseries is upheld by asking parents to wear identification bracelets to distinguish themselves as the proper parents. This reduces the chance of mistakenly allowing a parent or other adult to take a baby that is not theirs. If the nurse does not know the man in question, she should request some form of identification from him, such as the hospital bracelet. 5. A nurse is providing education to a group of 6th grade students on choosing well-balanced meals in the cafeteria. If she wants to use an example of a well-balanced meal, which of the following would be a good example? Assume no dietary restrictions apply. Peanut butter on 2 slices of wheat bread, 1 cup of carrots, 8 ounces of glass of water. B. Breaded chicken on 2 slices of white bread, 1 cup of sliced apples and 8-ounce glass of water. C. Soft pretzel with cheese, 1 cup of carrots, 8-ounce glass of water. D. Garden salad with ranch dressing, 1 cup of French fries, 1 cup of sliced apples, and 8 ounces of water. Correct answer, peanut butter on 2 slices of wheat bread, 1 cup of carrots, 8 ounces of glass of water. Peanut butter on 2 slices of wheat bread would supply protein and carbohydrates the student would need for energy. With this choice, the student also would receive a serving of vegetables. B is not the best choice because grilled chicken is always preferred to breaded or fried, and also wheat bread is more nutritious than white. C and D are both incorrect as neither supply a sufficient amount of protein and have significant amount of fat and simple carbohydrates. 6. Which of the following is an age-related developmental task for a 68-year-old client? A. Dealing with loss of friends. B. Commitment to parenthood. C. Setting career goals. D. Solidification of sense of self. Correct answer: A. Dealing with loss of friends. A person who is 68 years old may be dealing with several changes associated with retirement and advancing age. Loss of friends due to death, ending of a career, loss of a spouse, and loss of some physical functions and abilities are all associated with aging. 7. Which of the following complications is associated with premature rupture of membranes in the pregnant client? A. Vaginal or cervical lacerations. B. Shoulder dystocia. C. Uterine rupture. D. Chorioamnionitis. Correct answer: D. Chorioamnionitis. Premature rupture of membranes occurs when the amniotic sac of a pregnant client has ruptured before the onset of labor. The client may be at increased risk of chorioamnionitis, which occurs as inflammation of the membranes of the placenta. Infection may develop when bacteria ascend into the uterus without the protection of the intact amniotic sac. 8. A nurse is educating a female client about progesterone. Which of the following information is appropriate to include in this teaching? A. Progesterone helps the body to maintain pregnancy. B. Progesterone stimulates the breasts to secrete milk. C. Progesterone causes uterine contractions during delivery. D. Progesterone causes development of masculine characteristics in women. Correct answer: progesterone helps the body to maintain pregnancy. Progesterone is a hormone that is produced by the ovaries in women. Progesterone affects the tissue of the endometrium by developing the lining of the uterus in support of embryo implantation. In pregnant women, progesterone nourishes the uterine lining and limits uterine contractions to prevent miscarriage. 9. A nurse is assisting with counseling for a pregnant client who has had genetic testing performed for her unborn child. The geneticist tells this mother that her baby has an extra copy of the 21st chromosome in every cell. Based on this information, the nurse knows that the baby will most likely be born with which condition? A. Turner syndrome. B. Patau syndrome. C. Down syndrome. D. Edwards syndrome. Correct answer: C. Down syndrome. A genetic condition that causes an extra copy of chromosome 21 in each cell is known as trisomy 21, or Down syndrome. Trisomy occurs when there are 3 chromosomes for each cell instead of the usual 2. It is named and its symptoms occur based on the affected chromosomes. 10. A pregnant client who is at 38 weeks gestation is seen for prenatal care at a community clinic. The nurse asks the client to lie down while waiting for the physician to arrive. After several minutes of lying on her back, the client becomes dizzy and lightheaded. She is agitated and states she feels she might faint. What is the next action of the nurse? A. Call the physician to check the client immediately. B. Call 911 for an ambulance to transport the client to the labor and delivery unit of the hospital. C. Check the client's blood pressure and temperature. D. Assist the client to lie on her side. Correct answer: D. Assist the client to lie on her side. A pregnant client who is in the 2nd or 3rd trimester may be unable to lie on her back for extended periods of time. The weight of the baby may compress the vena cava and the descending aorta, decreasing circulation and causing lightheadedness, dizziness, agitation, or syncope. This is referred to as supine hypotension or vena cava syndrome and may be resolved quickly by changing to the side-lying position, thereby restoring circulation. 11. Which example best describes the concept of beneficence? A. A client has an advance directive in place stating that he does not want intubation if he needs CPR. B. A nurse provides pain medication for a client in the recovery room who is experiencing pain. C. At the request of the client, a nurse does not inform his family about his cancer diagnosis. D. A nurse withholds narcotic medication for a client in pain, knowing that he is currently disoriented. Correct answer: B. A nurse provides pain medication for a client in the recovery room who is experiencing pain. Beneficence is the concept of doing what is good and right for the client. A recovery room nurse who cares for a client who is having pain after surgery follows beneficence when providing pain medication to make him more comfortable. 12. A nurse is at the beginning of her shift in a long-term care facility. Which of the following clients should she check on first? A. A 91-year-old man who needs help eating breakfast. B. An 86-year-old man who has been incontinent in his bed. C. An 82-year-old woman who needs 4 antibiotics. D. A 75-year-old man who is recovering from an injury who needs an ice pack. Correct answer: C. An 82-year-old woman who needs 4 antibiotics. When determining which client to see first while in a long-term care facility, the nurse should decide what tasks are most important that only she can do. If other assistive personnel are present, the nurse can delegate some tasks to continue to meet the needs of the clients. In this scenario, the 4 medication is the only task that must be done by the nurse. 13. The charge nurse is notified that the unit will be receiving an admission of a client from another bed in the hospital in order to make room for others being admitted through the emergency room. The unit is the Women's Health Center of the hospital. Which of the following people would be most appropriate to be transferred to this unit? A. A 26-year-old woman who had a bowel resection. B. A 40-year-old man who underwent a hernia repair. C. A 31-year-old woman with septicemia and who is on a ventilator. D. A 91-year-old man with Alzheimer's disease recovering from a fall. Correct answer: A. A 26-year-old woman who had a bowel resection. When making decisions about the transfer of clients between units in the hospital, the nurse must decide on the most appropriate person to be transferred based on the client's condition, the staffing levels of the unit, and the purposes of the unit overall. The women's health unit of a hospital would accept female clients that do not require intensive or 1:1 care. 14. A 22-year-old patient has been declared to have experienced an irreversible cessation of brain activity following a motor vehicle accident. The nurse has the legal obligation to address organ donation with the family. The nurse's priority action at this time would be to A. Determine who is legally responsible to provide consent. B. Provide a private area where the family can discuss organ donation. C. Notify the physician of patient condition. D. Notify Center for Organ Recovery and Education, CORE. Correct answer: D. To notify Center for Organ Recovery and Education, CORE. The priority action by the nurse would be to notify CORE of the patient's condition. The next action would be to provide a private area where the family can discuss organ donation and determine who provides consent. 15. Examples of preservation of self-integrity include all of the following except A. Using assistive equipment to move bariatric clients. B. Participating in wellness programs. C. Accepting the challenge of caring for clients with oppositional beliefs or practices. D. Using hand hygiene and personal protective equipment. Correct answer: C. Accepting the challenge of caring for clients with oppositional beliefs or practices. Preserving self-integrity involves taking care of oneself in order to maintain positive nursing practices and to avoid burnout. Self-integrity involves self-care and is manifested in actions that protect or support the nurse. If barriers exist within care settings that are too challenging for nurses to overcome without sacrificing their integrity, they should request a different assignment in order to uphold their own self-care. 16. Which of the following is an example of intragroup conflict? A. A nurse writes a grant for a non-profit organization to raise money for advertising. B. Members of a multidisciplinary team cannot agree on the best course of action for a client. C. A client does not receive his medication on time because the nurse was on break. D. A nurse feels frustrated that her employer does not provide on-site child care. Correct answer: B. Members of a multidisciplinary team cannot agree on the best course of action for a client. Intragroup conflict occurs when disagreements happen between members of a same group. Various professionals serving on a multidisciplinary team may develop intragroup conflict if those involved cannot agree on a decision of how best to care for a client. 17. What does an anti-kickback statute prevent? A. It prevents healthcare workers from providing food or parties to celebrate special occasions at work. B. It promotes thorough and complete documentation when a client becomes injured. C. It forbids giving or accepting gifts to promote or provide referrals for certain services. D. It prevents physicians from ordering treatments that may require nursing care that is over and above the usual amount. Correct answer: C. It forbids giving or accepting gifts to promote or provide referrals for certain services. An anti-kickback statute prevents healthcare providers, clients, consultants, or related organizations from giving or accepting gifts in order to reward others for referring services. Organizations that provide gifts of food, donations, or personal items targeted toward nursing staff in exchange for referral of services are violating this statute. 18. The nurse working at an acute care hospital is transferring a patient to a skilled nursing facility. The patient's vital signs documented at 1400 R, T 37.5 degrees Celsius, P 88, RR 16, BP 135/70, SP 0293% on RA. The following vital signs documented at 1800, just prior to discharge, are as follows: T 38.5 degrees Celsius, P 102, RR. 18, BP 158/82, SP 02-91% on RA. What should be the nurse's next course of action? A. Discharge the patient, but notify the skilled nursing facility of the patient's change in status. B. Discharge the patient, but notify the physician of patient's change in status. C. Delay discharge and notify the physician of the patient's change in status. D. Delay discharge and notify the skilled nursing facility of the patient's change in status. Correct answer: C. Delay discharge and notify the physician of the patient's change in status. The nurse would not continue with the discharge process if there has been a change in patient status. The patient must be stable in order to be discharged safely. However, the nurse must notify the physician immediately with the changes prior to notifying the skilled nursing facility. 19. Which of the following is an example of intrapersonal conflict? A. Hospital bills are denied by an insurance company due to policies. B. A nurse is called to testify in court about a client she cared for 3 years ago. C. A nurse feels guilty when she administers essential medication that causes a client to have nausea and vomiting. D. The spouse of a nurse is upset that she is working overtime. Correct answer: C. A nurse feels guilty when she administers essential medication that causes a client to have nausea and vomiting. Intrapersonal conflict involves negative feelings or frustrations within oneself. Intrapersonal conflict may be related to decisions or actions that clash with personal morals or beliefs. A nurse who feels guilty about administering important medication that involves negative side effects may be struggling with intrapersonal conflict. 20. A nurse with 5 years of experience working in a hospital unit is promoted as a mentor and preceptor to a new nursing staff. This is an example of collegiality. B. Competence. C. Advocacy. D. Integration. Correct answer: collegiality. Collegiality is the action of forming relationships and supporting others through work experiences. A nurse who becomes a mentor to other nurses fosters an encouraging educational relationship with those she mentors by demonstrating appropriate nursing care. Nurses who act as preceptors often teach skills to new nurses, further advancing educational goals and activities. 21. Which of the following is an example of libel? A. A client overhears a nurse telling her assistant that he is too high maintenance. B. A client reads disparaging remarks that a nurse has written about him in his chart. C. A nurse fails to notify a physician when a client's hemoglobin level is 8.1 gm/dl. D. A nurse administers narcotic pain medication to a client in pain but does not have an order. Correct answer: B. A client reads disparaging remarks that a nurse has written about him in his chart. Libel involves statements against another person that are in written form. The information injures the other person's reputation or feelings. Libel occurs when a client reads negative remarks about himself that were made by the nurse and were written in his chart. 22. Mr. R is being seen in his physician's office for swollen and painful joints. The most obvious joint affected is his great toe, which has become large, red, and painful. Which of the following medications is most appropriate for this condition? A. Docusate sodium. B. Bismuth subsalicylate. C. Allopurinol. D. Cromolyn sodium. Correct answer: C. Allopurinol. Allopurinol is a medication often used in the treatment of gout. Gout occurs with a buildup of uric acid crystals in the body, which collect in the joints, causing warmth, redness, and tenderness. Gout often affects the great toe as a main source of uric acid collection. Allopurinol works by inhibiting production of uric acid. 23. Which of the following interventions reduces the risk of infection when administering an intramuscular injection? A. Draw up the solution approximately 5 minutes before administration. B. Keep the tip of the needle covered until administration. C. Clean the skin with an antiseptic swab in a half-inch radius. D. Check the client's temperature immediately after administering the injection. Correct answer: B. Keep the tip of the needle covered until administration. A nurse places a client at risk of infection when administering intramuscular injections because of a break in the skin. The nurse can reduce this risk by keeping the needle of the syringe covered after drawing up the solution until she is ready to administer the drug. This reduces the risk of needle contamination that would introduce pathogens into the client's body. 24. A nurse is attempting to start N4 in a client's arm and is having difficulty with finding a vein to use. The client's skin is cold. Which intervention of the nurse may improve the situation? A. Raise the client's hand so that it remains at a level above the heart. B. Place a warm pack on the client's arm for 5 minutes before looking for a vein. C. Instruct the client to drink a quart of warm water. D. Apply a tourniquet 12 inches above the foresight. Correct answer: B. Place a warm pack on the client's arm for 5 minutes before looking for a vein. Cold skin may cause sluggish circulation and increased difficulty with starting N4. A nurse can apply a warm pack to the area where she plans to insert the catheter, leaving it in place for approximately 5 minutes. This action will warm the skin and surrounding tissues and increase blood flow to the site. 25. A client is being admitted on a routine basis for fluids to correct an electrolyte balance. Which of the following sites is most appropriate for starting N4 in this client? A. A vein in the antecubital fossa. B. A vein in the dominant hand. C. A vein in the foot. D. A vein in the non-dominant hand. Correct answer: D. A vein in the non-dominant hand. If a nurse has a choice of sites in which to start N4 and the situation is not an emergency, she should try to start a line in the client's non-dominant hand. This frees the client to use his dominant hand while receiving fluids at the same time. Hands are the most frequent site of insertion, as well as the most convenient. Many emergency situations necessitate the use of the vein in the antecubital fossa. 26. Which of the following interventions best helps to facilitate insertion of an intravenous catheter? A. Ask the client to look away during the procedure. B. Puncture the skin at a 5 to 10 degree angle. C. Advance the catheter until resistance is met. D. Secure the device at a 45 degree angle to the skin. Correct answer: C. Advance the catheter until resistance is met. The nurse can have greater success with starting N4 by following a few protocols that will facilitate easier insertion. The client should be aware that the nurse is starting N4. Once the catheter is inserted, the nurse should advance it until a small amount of resistance is met. This indicates the catheter has reached the vein. By lowering the needle slightly, the nurse can then enter the vein, which should provide a flashback of blood in the catheter. 27. A client with N4 is complaining of pain at the insertion site. There is a bruise at the site, the skin is tender, and the N4 fluid will not flow. Which of the following conditions is the most likely cause of these symptoms? A. Hematoma. B. Phlebitis. C. Extravasation. D. Venous spasm. Correct answer: A. Hematoma. A hematoma may occur at N4 site when blood leaks from the vessel into the surrounding space. A hematoma may feel painful and the area may be tender. A bruise may also develop at the site if blood collects in the tissue under the skin. 28. Which of the following solutions is compatible with administration of packed red blood cells? A. Lactated ringers. B. 0.9% normal saline. C. D5 1/2 normal saline. D. Normasol R. Correct answer: B. 0.9% normal saline. During blood administration, the only acceptable solution that is compatible is 0.9% normal saline. This is an isotonic solution that maintains the balance of fluid moving into and out of the cells. Other products may have additives that can cause the blood to form small clots in the solution. 29. Which of the following is an example of a colloid solution? A. 5% dextrose in water, D5W. B. Albumin. C. Lactated ringers. D. Wormol. Saline. Correct answer: B. Albumin. Colloid solutions are those that have large enough particles that they do not cross cell membranes from the bloodstream. Instead, colloids often remain in the bloodstream, which is why they might be used as volume expanders in some clients, such as those with low blood pressure due to low blood volume. An example of a colloid is albumin. 30. A nurse is preparing to administer packed red cells for Mr. H when she realizes that he does not have N4. What is the minimum size of catheter the nurse must use in this situation? A. 30 gauge. B. 28 gauge. C. 24 gauge. D. 20 gauge. Correct answer: D. 20 gauge. When administering packed red blood cells, the nurse should give the infusion through N4 that is large enough to permit the flow of cells into the client's body. Small bore 4 catheters may not be large enough to accommodate the size of red blood cells. When given a choice of 4 to use for packed cell administration, the nurse should choose N4 that is size number 20 gauge or larger. 31. A nurse is caring for a client who has been ordered to receive a rapid infusion of packed cells to support his intravascular blood volume. She starts to administer the blood at a fast drip rate and realizes that the blood is not infusing. Which of the following actions may the nurse perform to correct this situation? A. Raise the client's arm above his head. B. Place the client in the Trendelenburg position. C. Place a pressure bag around the blood container. D. Start a new 4 and simultaneously administer a second unit of blood. Correct answer: C. Place a pressure bag around the blood container. A pressure bag is a device used for intravenous fluids that increases the rate of administration. A pressure bag is placed around the bag of fluid or blood and is connected to a small hand pump, similar to that of a sphygmomanometer. The nurse inflates the pump, which causes the pressure bag to squeeze the fluid bag. This squeezing action creates the pressure needed to propel fluid through the tubing and into the client at a faster rate. 32. Which of the following actions is part of preparation of a medication from an ampoule? A. Snap the neck of the ampoule toward the body. B. Hold the ampoule upside down when drawing up the medication. C. Expel excess air bubbles back into the ampoule. D. Always use the same needle for drawing as the one used for the injection. Correct answer, B. Hold the ampoule upside down when drawing up the medication. Ampoules are glass vials that contain medication for intramuscular or intravenous use. Because of their composition, ampoules should be handled carefully. The nurse should cover the neck of the ampoule with an alcohol wipe and snap it open in a direction away from the body. Holding the vial upside down, the nurse draws up the formula, using a different needle than the one that will be used for injection of the medication to the client. 33. Mr. C is brought to the hospital with severe burns over 45% of his body. His heart rate is 124 bpm and thready, BP 84/46, respirations 24/minute and shallow. He is apprehensive and restless. Which of the following types of shock is Mr. C at highest risk for? A. Septic shock. B. Hypovolemic shock. C. Neurogenic shock. D. Cardiogenic shock. Correct answer, B. Hypovolemic shock. A client who has suffered severe burns may be at risk of hypovolemic shock. Burns cause a loss of plasma volume, depleting the amount of fluid in circulation, decreasing perfusion to essential organs and to the extremities. 34. Based on Mr. C's assessment, which of the following nursing interventions is most appropriate? A. Elevate the lower extremities to 45 degrees to promote venous return. B. Place Mr. C in the Trendelenburg position. C. Administer total parenteral nutrition. D. Monitor urine output. Correct answer, D. Monitor urine output. A client in hypovolemic shock may have decreased urine output related to poor kidney perfusion. The nurse should administer fluids as ordered and monitor urine output to ensure that it remains above 30 cubic centimeters per hour. 35. Mr. L was working in his garage at home and had an accident with a power saw. He is brought into the emergency department by a neighbor with a traumatic hand amputation. What is the first action of the nurse? A. Place a tourniquet at the level of the elbow. B. Apply direct pressure to the injury. C. Administer a bolus of 0.9% normal saline. D. Elevate the injured extremity on a pillow. Correct answer, B. Apply direct pressure to the injury. When a client is seen for an injury that causes excessive bleeding, the first action of the nurse is to apply direct pressure to the wound. Firm pressure with a sterile dressing can be applied while the rest of the emergency team works together to stabilize the injury and prepare for surgery. 36. A client is admitted for a head injury. His body is lying in an abnormal position and the physician states he is exhibiting decorticate posturing. Based on this assessment, the nurse can expect to find the client with A. The legs extended and rotated internally, the elbow, wrists, and fingers flexed. B. The legs pulled toward the chest, the head bent back at a 30-degree angle. C. The back arched, the arms and legs extended and rigid. D. The legs extended and rotated externally, the head turned to the right or the left. Correct answer, A. The legs extended and rotated internally, the elbow, wrists, and fingers flexed. Decorticate posturing indicates an injury to the corticospinal tract. The client may exhibit this posture unexpectedly or it may develop when the client's body is stimulated. A client who exhibits decorticate posturing lies with the legs extended and rotated internally, the elbows, wrists, and fingers are flexed inward. 37. All of the following signs are indicative of increased intracranial pressure except decreased level of consciousness. B. Projectile vomiting. C. Sluggish pupil dilation. D. Increased heart rate. Correct answer, D. Increased heart rate. A client with increased intracranial pressure may develop life-threatening complications if the condition remains untreated. The nurse should be aware of early signs of this condition among clients at risk to avoid herniation of brain tissue. Signs of increased intracranial pressure include decreased level of consciousness, decreased heart rate, abnormal respirations, sluggish pupil dilation, and projectile vomiting. 38. A client is diagnosed with Meniere's disease after suffering from a viral infection. The nurse recognizes that this condition causes chronic rash, inflamed skin, and encrusted lesions. B. Orthostatic hypotension and swelling of the extremities. C. Altered potassium levels and increased risk of cardiac dysrhythmias. D. Vertigo, tinnitus, vomiting, and hearing loss. Correct answer, D. Vertigo, tinnitus, vomiting, and hearing loss. Meniere's disease is a condition affecting the inner ear that manifests as recurrent vertigo and tinnitus. The client may develop nausea, vomiting, or nystagmus, and the condition may result in hearing loss. The nurse can assist this client by providing a dark and quiet environment and administering medications as ordered to control nausea and vomiting. 39. Mrs. P is being admitted for complications of coronary artery disease. The nurse places her on a cardiac monitor and notes that her heart rate is 210 bpm and occasionally irregular. She is unable to measure the PR interval because the rate is too fast. The QRS complexes are wide. Which of the following conditions does this client most likely have? A. Premature ventricular contractions. B. Atrial fibrillation. C. Ventricular tachycardia. D. Sinus tachycardia. Correct answer, C. Ventricular tachycardia. A client with a heart rate between 110 and 250 bpm with wide QRS complexes may be in ventricular tachycardia. The condition is often caused from complications of coronary artery disease, after an acute myocardial infarction, or through such conditions as hypokalemia or digoxin toxicity. 40. A nurse is caring for Mr. W, who has been HIV positive for 7 years. Mr. W was recently diagnosed with Mycobacterium avium complex, MAC. Based on this diagnosis, the nurse can expect which of the following symptoms from this client? A. Cardiac dysrhythmias. B. Swelling of the lips and face. C. Headache and a ruddy complexion. D. Lethargy and diarrhea. Correct answer, D. Lethargy and diarrhea. An HIV-positive client who develops MAC may show symptoms of lethargy, diarrhea, fever, weight loss, or night sweats. The condition may progress to cause hepatitis or pneumonia as well. Mycobacterium avium complex is type of opportunistic infection that causes illness among people with decreased immune systems. 41. Based on Mr. W's diagnosis of MAC, which of the following information should be provided to this client? A. He should be started on antiretroviral therapy as ordered. B. He is no longer just HIV positive, he most likely has AIDS. C. He should be tested for other illnesses, such as anemia. D. Both B and C. Correct answer, D. Both B and C. A diagnosis of MAC in a client who is HIV positive occurs when the associated bacteria takes advantage of a compromised immune system. The client's CD4 count has typically dropped low enough that he cannot protect himself from opportunistic infections. Because of this, Mr. W most likely has progressed to AIDS. He should be tested for other illnesses that may develop because of MAC, including anemia or hepatitis. 42. A client begins to choke on food while eating in her room and a nurse is attempting to perform the Heimlich maneuver. After several seconds, the client becomes unconscious. What is the next action of the nurse? A. Continue to support the client's body weight by standing behind her and performing abdominal thrusts. B. Ask a coworker to hold the client while continuing to perform abdominal thrusts. C. Ease the client to the ground and expose the chest. D. Perform a blind finger sweep to remove any objects and begin rescue breathing. Correct answer: C. Ease the client to the ground and expose the chest. A client who becomes unconscious while choking should be carefully eased to the ground before attempting further measures. The nurse should look in the client's mouth to determine if any foreign objects are present that have caused the choking. If the object is visible, the nurse can perform a finger sweep to remove it. Basic care and comfort 43. A nurse is providing discharge instructions to a patient who will be discharged to a transitional care unit following a right-sided CVA. The patient is ordered a standard walker for ambulation. Which statement by the nurse is the correct discharge instructions for the patient? A. Step forward with your left foot, then with your right foot. B. Step forward with your right foot, then with your left foot. C. Pull on the walker in order to push up from your chair. D. Keep the walker 12 inches in front of you when ambulating. Correct answer: A. Step forward with your left foot, then with your right foot. When using a walker, the patient should be instructed to step forward with their weaker side first. In a right-sided CVA, the weaker or affected side is the left. A patient should never be instructed to pull up on their walker to sit up and should also remain within the 4 points of the walker at all times when ambulating. 44. The nurse is assessing a patient at 1900 who has underwent a total knee replacement. The patient was ordered anti-embolic stockings by his physician to prevent thrombus formation. The stockings were applied at 1100 and have not yet been removed. The following action taken by the nurse is a priority. A. Notify the physician, as the patient is at risk for thrombus formation. B. Remove the stockings and assess skin, circulation, and presence of edema in the legs. C. Report the previous nurse who provided care for this patient as she neglected to remove the stockings. D. Document the removal of the stockings. Correct answer: B. Remove the stockings and assess skin, circulation, and presence of edema in the legs. Anti-embolic stockings should be removed every 8 hours to assess for redness, warmth, and/or tenderness. Since the stockings were only applied 8 hours ago, the previous nurse did not neglect the patient. The nurse would document the removal or reapplication of the stockings. However, this is not the priority in this scenario. 45. A nurse is preparing to attach a TENS unit to a client who is experiencing pain. Which of the following actions is most appropriate in this situation? A. Tell the client that he may experience tingling sensations. B. Connect the TENS unit before the client goes to bed for the night. C. Tell the client that the TENS unit may have pain-reducing effects for 10 to 15 days. D. After treatment, notify the client that he may not use a TENS unit again for at least 2 weeks. Correct answer: Tell the client that he may experience tingling sensations. A transcutaneous electrical nerve stimulation (TENS) unit is a non-pharmacological form of pain control that is used by attaching electrodes to a client's skin near areas where he is feeling pain. A client using a TENS unit should feel tingling sensations, but not to the extent that the muscles begin to twitch. The therapeutic effects of a TENS unit may last 3 to 5 days. 46. When cleansing the genital area during perineal care, the nurse should underscore: A. Cleanse the penis with a circular motion starting from the base and moving toward the tip. B. Replace the foreskin after it has been pushed back to cleanse an uncircumcised penis. C. Cleanse the rectal area first and then clean the patient's genital area. D. Use the same area on the washcloth for each washing and rinsing stroke for a female resident. Correct answer: B. Replace the foreskin after it has been pushed back to cleanse an uncircumcised penis. It is important to retract the foreskin of uncircumcised male patients in order to remove the smegma that collects under the foreskin. This smegma can lead to bacterial growth and infection. The foreskin is then replaced after the penis is cleaned. 47. You are ready to wash your patient's face. You would start by washing what area of the face? A. The forehead. B. The eyes. C. The ears. D. The cheeks. Correct answer, B. The eyes. The eyes are the first area to be cleaned. The eye area is considered the priority in terms of moving from an area that can be potentially infected to areas of the face and body that are least able to become infected with a washcloth. 48. A nurse is attempting to assess a client's pulse in his foot. She palpates the pulse on the anterior aspect of his ankle, below the lower end of the medial malleolus. Which type of pulse is this nurse taking? A. Dorsalis pedis. B. Popliteal. C. Posterior tibial. D. Femoral. Correct answer, C. Posterior tibial. The nurse can palpate the posterior tibial pulse to assess circulation to the foot and ankle. The posterior tibial pulse is felt by palpating the inner side of the ankle, behind the medial malleolus. 49. A client has been diagnosed with a form of terminal cancer and has started receiving hospice care. The nurse notes that both the client and his family avoid talking about the diagnosis. All attempts at discussion result in changing the subject. The nurse recognizes that this family is exhibiting closed awareness. B. Mutual pretense. C. Open awareness. D. Powerless assessment. Correct answer, B. Mutual pretense. Mutual pretense is a form of awareness as a response to death or dying in which those involved avoid discussing the situation. In a case of terminal illness, a client and his family are aware of the diagnosis, but the client may not want to talk about the situation for various reasons, such as saving his family from feelings of grief, fear of the future, or discomfort with talking about feelings. 50. A nurse is preparing to talk about body changes with a client who just had a bilateral mastectomy. Which of the following actions of the nurse is most appropriate during this discussion? A. Provide a room that offers minimal distractions. B. Ask closed-ended questions to allow the client to think about her situation. C. Write detailed notes during the conversation to track important information. D. Ask personal questions about the client's background to determine how the procedure has affected her self-concept. Correct answer, provide a room that offers minimal distractions. When preparing to talk with a client about a difficult subject, the nurse can provide an environment that is private and that offers minimal distractions. This gives the client an opportunity to open up about personal feelings without being interrupted, and may provide more open communication between the nurse and client. 51. A nurse is attempting to speak with a client about his personal feelings of self-esteem and self-concept. Which of the following questions is most appropriate for assessing a client's personal identity? A. What is your educational background? B. Are your parents still living? C. What do you like about your life right now? D. Where do you see yourself in 10 years? Correct answer, C. What do you like about your life right now? When assessing a client's personal identity, the nurse should focus on questions that determine how the client feels about himself. This may mean asking questions that help him identify his personal strengths and weaknesses, as well as how he thinks others see him. 52. A term that refers to a comprehensive set of thoughts or images of oneself is called A. Global self. B. Core self-concept. C. Personal identity. D. Ideal self. Correct answer, A. Global self. Global self refers to a comprehensive set of thoughts or images about oneself. A nurse can assess a client's global self-concept by asking him to use a phrase that describes himself completely at any given time. The phrase, "I am a man," is an example of a global self-concept. 53. A nurse is experiencing stress on a busy medical surgical unit. Each staff nurse has 5 patients and one of the 2 nursing assistants, NA, called off this morning. The nurse has 1 patient requesting pain medication every 2 hours, 1 asking for a bed bath, and another patient who is hemodynamically unstable. The nurse begins to cry in the hall stating, "I can't do this," to another nurse. The nurse is advised to prioritize the patient needs and delegate what she can to another nurse, a charge nurse or the NA. The advice given to the nurse is an example of which of the following behavioral techniques: A. Priority restructuring. B. Biofeedback. C. Mindfulness. D. Assertiveness training. Correct answer: A. Priority restructuring. The advice is an example of priority restructuring. This technique is used to reduce the amount of stressors on the nurse so that the situation becomes manageable. Prioritizing and delegation are examples of ways to reduce the total number of stressors. 54. Which of the following interventions is most appropriate when supporting the psychosocial needs of a client who is experiencing negative side effects associated with chemotherapy? A. Read the client's discharge instructions well in advance of dismissal. B. Provide medications to reduce nausea and vomiting. C. Give simple instructions about self-care while in the hospital. D. Determine the levels of support from significant others. Correct answer: D. Determine the levels of support from significant others. The nurse can address the psychosocial needs of a client who is undergoing changes in health and body image by determining the levels of support from the client's significant others. This may be family, a spouse, or friends who will provide help and support when the nurse is not directly caring for the client. Organizing these resources can address fears about the future. It prepares caregivers for the needs of the client, and it provides transition for the client who will eventually be discharged from nursing care. 55. Which of the following clients is at the highest risk of becoming a victim of intimate partner violence? A. A 36-year-old woman who is recently divorced. B. A 22-year-old man who is unemployed but living with friends. C. A 20-year-old woman who grew up with a psychologically abusive father. D. A 40-year-old man diagnosed with schizophrenia. Correct answer: C. A 20-year-old woman who grew up with a psychologically abusive father. Intimate partner violence is a form of domestic violence that includes physical, psychological, or sexual abuse from a spouse or partner. While intimate partner violence may occur with anyone in an intimate relationship, there are some risk factors that may be associated with a greater chance of becoming a victim. Young age, depression, low self-esteem, financial difficulties, little education, and being a former victim of some sort of abuse all contribute as risk factors for intimate partner violence. 56. A nurse is assessing a client who is being seen for increased anxiety, restlessness, and insomnia. Which of the following interventions is the first priority of the nurse? A. Administer anti-anxiety medications as ordered by the physician. B. Talk with the client about methods to improve rest and sleep. C. Take the client to a private room and remain with him. D. Review the client's medical history to determine if he has been treated for these issues before. Correct answer: C. Take the client to a private room and remain with him. The first priority when working with a client who has a potential mental health issues is to ensure safety of the client. The nurse should take the client to a private room to minimize distractions and stay with the client to ensure his safety. Other interventions, such as administering prescribed medications, can be performed after the nurse has instilled a trusting relationship. 57. A nurse is educating a client who is preparing to give a stool sample for occult blood. All of the following information is part of teaching for this client except A. Avoid eating red meat for 3 days before the test. B. Collect the stool from the toilet after having a bowel movement. C. The stool does not need to be kept in a container with preservative. D. A small part of the stool from 2 areas will be tested using a smear. Correct answer: B. Collect the stool from the toilet after having a bowel movement. When checking a stool sample for occult blood, the nurse may need to provide some teaching for the client, particularly if the client collects the stool himself. Part of education in this situation involves teaching the client to avoid red meat, as the blood in the meat may interfere with the test. The client should not collect the stool from the toilet as this may disturb the test results. 58. Which of the following interventions is necessary before insertion of an arterial line into the radial artery? A. Ensure that the client does not need surgery. B. Assess the client's grip strength. C. Perform an Allen test. D. Check a serum potassium level. Correct answer: C. Perform an Allen test. Before a physician inserts an arterial line using the radial artery, the nurse should perform an Allen test to assess the client's circulation. To perform the Allen test, the nurse compresses both the radial and ulnar arteries that provide circulation to the hand. She then maintains occlusion on the radial artery while releasing the ulnar artery and checks the blood flow to the hand. This test ensures that if the radial artery is cannulated with an arterial line, the ulnar artery can still provide adequate blood flow. 59. Mrs. M has had diabetes for 7 years. She has worked hard to control her blood glucose levels and watch her dietary intake. Her physician orders a hemoglobin A1C test. Which of the following best describes the action of this test? A. The test determines if the client is anemic and needs iron supplements. B. The test determines if there is excess glucose building up in the urine. C. The test determines the amount of hemoglobin reaching the liver to support gluconeogenesis. D. The test determines the amount of hemoglobin that is coated with glucose. Correct answer: D. The test determines the amount of hemoglobin that is coated with glucose. A hemoglobin A1C test, also known as a glycated hemoglobin test, determines the amount of hemoglobin that is coated with glucose. Excess glucose in the bloodstream may cause it to attach to hemoglobin on red blood cells. Because the life of these cells is between 2 and 3 months, the hemoglobin A1C is an accurate measurement of a client's glucose during that time. 60. A nurse is monitoring a client for decreased tissue perfusion and increased risk of skin breakdown. Which measure best improves tissue perfusion in this client? A. Massaging the reddened areas. B. Performing range of motion exercises. C. Administering antithrombotics as ordered. D. Feeding the client a high-carbohydrate diet. Correct answer: B. Performing range of motion exercises. A client at risk of impaired skin integrity should increase mobility as much as possible to increase tissue perfusion. For a client who is mobile, frequent ambulation may help improve circulation. For a client who is unable to get out of bed, frequent turning or range of motion exercises will increase tissue perfusion and decrease the risk of skin breakdown. 61. A nurse is caring for an 83-year-old man who has had swallowing difficulties. All of the following interventions are appropriate for this client except: keep the client in an upright position at all times. B. Auscultate lung sounds every shift and after feedings. C. Maintain suction equipment at the client's bedside. D. Instruct the client about how to perform swallowing exercises. Correct answer: keep the client in an upright position at all times. A client who has difficulty swallowing is at risk of aspiration of food into the lungs. Nursing interventions in this situation include auscultating lung sounds each shift and after meals to assess for changes in breathing patterns, helping the client with swallowing exercises through occupational therapy, and maintaining suctioning equipment at the bedside in case of difficulties. 62. A nurse is preparing to insert an indwelling catheter in a female client. Which of the following positions of the client is most appropriate for this procedure? A. Lithotomy position. B. Prone position. C. Dorsal recumbent position. D. High Fowler's position. Correct answer: C. Dorsal recumbent position. When preparing to insert an indwelling catheter for a female client, the nurse may have success placing the client in the dorsal recumbent position. In this position, the client lies supine with the knees bent. The nurse may ask the client to rotate the legs outward, relaxing the thighs. A client who cannot lie supine may also be comfortable in the Sims position. 63. A client is preparing to undergo a cystoscopy for stones. Which of the following statements indicates that the client understands the procedure? A. I better drink a lot of fluid now because I won't be able to after the test. B. I will probably see a little blood when I urinate. C. I will be able to go home after 3 days in the hospital. D. I won't need any pain medicine, this probably will not hurt. Correct answer, B. I will probably see a little blood when I urinate. A cystoscopy is a procedure that involves inserting a scope into a client's bladder to inspect the structures or to remove objects such as stones. A cystoscopy is typically done under local or general anesthesia, and the client may experience a small amount of hematuria or pink-colored urine following the procedure. 64. Which of the following conditions may warrant a serum creatinine level? A. Rhabdomyolysis. B. Digitalis toxicity. C. Glomerulonephritis. D. All of the above. Correct answer, D. All of the above. Creatinine is a byproduct of the breakdown of creatine, which is created by the muscles. The kidneys excrete creatinine. This test may be performed for a client who has had an injury to the muscles that may produce a significant amount of creatinine, or a client who has a condition that can impair renal function. 65. Which nursing intervention is most appropriate to maintain the patency of a client's nasogastric tube? A. Maintain constant connection to low intermittent suction. B. Irrigate the tube as per physician order. C. Suction the mouth and nose every shift. D. Perform a daily fecal occult blood sample. Correct answer, B. Irrigate the tube as per physician order. A client with a nasogastric tube may be at increased risk of the tube kinking or clotting off, rendering it unusable and putting the client at risk of abdominal distension or vomiting. The nurse can assess for tube patency by irrigating the tube with water or fluid as ordered by the physician on a routine basis or by facility policy. 66. Alzheimer's disease patients wander. The dangers associated with this wandering can be prevented with which of the following? A. Bed alarms. B. Chair alarms. C. Door alarms. D. All of the above. Correct answer, D. All of the above. Bed alarms, chair alarms, and door alarms that ring when a wandering person tries to leave the building help to keep patients safe. Listen for and respond to alarms immediately. 67. Mr. S has just been diagnosed with active tuberculosis. Which of the following nursing interventions should the nurse perform to prevent transmission to others? A. Begin drug therapy within 72 hours of diagnosis. B. Place the client in a positive pressure room. C. Initiate standard precautions. D. Place the client in a negative pressure room. Correct answer, D. Place the client in a negative pressure room. A client diagnosed with active tuberculosis should be placed in isolation in a negative pressure room to prevent transmission of infection to others. A negative pressure room exhausts air to the outside and receives air from surrounding areas, preventing tuberculin particles from traveling through the ventilation system to infect others. 68. Which of the following is an example of client handling equipment? A. Wheelchair. B. Height adjustable bed. C. Shower chair. D. Call light. Correct answer, B. Height adjustable bed. Client handling equipment is designed to reduce the stress and workload on nurses who must assist, turn, or lift clients. This equipment decreases the risk of injuries associated with improper lifting. A height-adjustable bed raises the client up to a proper working height for the nurse who must provide assistance. 69. Which practice will help to reduce the risk of a needle stick injury? A. Only expose the end of the needle once ready to enter the room for the procedure. B. Always place the cap back on a needle after it has been used. C. Keep a sharps container nearby where it can be easily accessed. D. Pass needles between nurses by using the handover technique. Correct answer: C. Keep a sharps container nearby where it can be easily accessed. When administering an injection or using sharps for a procedure, the nurse can minimize safety risks by keeping a sharps container nearby. This provides easy access for quick disposal to prevent the possibility of a needle stick. Needles should never be recapped after use, and nurses should always exchange needles from a central area rather than passing them between workers. 70. Which of the following actions can a nurse do to prevent a fire from occurring in the area where he works? A. Use an adapter when plugging in client equipment. B. Mark equipment that is not working properly and use carefully until it can be inspected by maintenance. C. Notify visitors or post signs that state oxygen is in use in certain areas. D. Keep extra equipment stored in one area with other supplies and materials. Correct answer: C. Notify visitors or post signs that state oxygen is in use in certain areas. Because oxygen is a combustible material, clients, workers, and visitors to the healthcare facility should be aware of its use. All people should be reminded of the consequences of improper oxygen use through signs or pictures that depict this risk. 71. Which principle of body mechanics may help to reduce the risk of a back injury incurred by the nurse? A. Maintain a narrow base of support. B. Bend from the waist, not the knees. C. Keep the back straight while lifting. D. If possible, lift objects rather than pushing or pulling. Correct answer: C. Keep the back straight while lifting. A nurse may minimize the risk of strain or injury by employing proper body mechanics while lifting, moving, or turning. Keeping the back straight, bending at the knees, maintaining a wide base of support, and pushing or pulling rather than lifting are all proper body mechanics that can reduce the risk of injury. 72. A nurse caring for a client diagnosed with pertussis is ordered to maintain droplet precautions. Which of the following actions of the nurse upholds droplet precautions? A. Assign the client to stay in a negative pressure room. B. Use sterilized equipment when sharing between this client and another person with pertussis. C. Wear a mask if coming within 3 feet of the client. D. Both A and C. Correct answer: C. Wear a mask if coming within 3 feet of the client. When working with a client who needs droplet precautions, the nurse should wear a mask when coming within 3 feet of the client. If the client coughs or sneezes, droplet particles could be transmitted through the air to infect the nurse without proper precautions. Droplet precautions should also involve the practice of standard precautions, such as regular hand hygiene and personal protective equipment when coming in contact with blood or body fluids. Case Study 3. The nurse assumes care of a 76-year-old client postoperatively following a partial small bowel resection on post-op day 1. Exhibit 1. Vital signs at 1622. Vital signs: T 99.0 degrees Fahrenheit, 37.2 AF, BP 158/90 mmHg, HR 102 BPM, RR 22 breaths/minute, pulse oximetry 96%, pain 0.8. 73. Exhibit 3. Flow sheet of vital signs. 1622, GCS 15. T 99.0 degrees Fahrenheit, 37.2, BP 110/72 mmHg, HR 92 BPM, pulse oximetry 96%, RR 22 breaths/minute, pain 8 out of 10. 1626, GCS 9. T 98.7 degrees Fahrenheit, 37.0, BP 166 mmHg, HR 78 BPM, pulse oximetry 89%, RR 10 breaths/minute. Pain unable to rate due to drowsiness. 1632, GCS 10. T 98.7 degrees Fahrenheit, 37.0, BP 124/76 mmHg, HR 86 BPM, pulse oximetry 95%, 2L nasal cannula, RR 12 breaths/minute, pain unable to rate due to drowsiness. 1637, GCS 9. T 98.6 degrees Fahrenheit, 37.0, BP 112/72 mmHg, HR 88 BPM, pulse oximetry 95%, 2L nasal cannula, RR 10 breaths/minute, pain unable to rate due to drowsiness. The nurse administers naloxone at 1627. After reviewing the client's vital signs and GCS, which action does the nurse take next? A. Continue to monitor the client. B. Administer analgesic medication. C. Administer an additional naloxone dose. D. Gather supplies for intubation. Correct answer, C. Administer an additional naloxone dose. The nurse should administer an additional naloxone dose after recognizing the client remains drowsy, and the respiratory rate remains decreased. The nurse takes into consideration both the respiratory rate and the GCS. These findings are reflected in the client's vital signs at 1632 and 1635 and are indicative that the client is still experiencing adverse effects from the morphine administration. The client's respiratory rate increased slightly from 10 to 12 breaths per minute, and the GCS had risen from 9 to 10 at 1632. However, the GCS and respiratory rate once again decreased at 1637. The surgeon has given the nurse a prescribed order to administer naloxone as needed every 2 to 3 minutes for up to 3 doses. Therefore, the nurse administered an additional naloxone dose. In an opioid overdose, it is not uncommon to administer multiple doses until the desired effect is achieved because the half-life of the opioid is typically longer than the antagonist. Answer B is incorrect. The client may need additional analgesic medication after naloxone is administered to combat an opioid overdose. Once naloxone is administered, the effects of the opioid will no longer be available. Although the client's respiratory rate will increase and the client will become more alert, the pain will also return. However, there is no need for an additional dose of an analgesic currently because the client's vital signs and GCS reflect the need for an additional naloxone dose. Administering an additional dose would worsen the client's condition. 74. The subsequent naloxone administration achieves the desired effect. The client's pain returns and the nurse observes mild sanguineous drainage and slight swelling under the sutures after assessing the surgical site. Which response by the nurse is correct when the client asks, "How does it look?" A. I am concerned about a complication called dehiscence and am calling the surgeon. B. Some bloody drainage is to be expected in the first few days following surgery. C. You are probably experiencing pain because the incision appears to be infected. D. I will let the surgeon tell you how your incision looks. Correct answer, B. Some bloody drainage is to be expected in the first few days following surgery. The nurse is correct when stating that the findings regarding the sanguineous drainage and swelling under the sutures on post-op day 1 are to be expected. The drainage should progress from sanguineous to serosanguineous to serous over the next few days. Answer A is incorrect. If the drainage increases instead of decreases after the 5th day or the drainage remains serosanguineous after the 5th day, the surgeon should be notified because this can be a sign of dehiscence. The client has expected findings for a post-op day 1 client. Therefore, telling the client about a concern for dehiscence is incorrect. Answer C is incorrect. Some swelling under the sutures on post-op day 1 is to be expected. There is no current indication that the nurse is concerned about infection this early in the client's recovery. The incision appears to have drainage that is expected in post-op day 1 following surgery. Answer D is incorrect. The nurse does not respond appropriately when telling the client that they will wait for the surgeon to tell them how the incision looks. The nurse should be able to recognize if the wound appears to be healing well or if findings are expected following surgery. By not providing the client with this information, the nurse is dismissing the client, and this can lead to unnecessary anxiety from the client. 75. In addition to analgesics, which interventions does the nurse include in the client's plan of care for pain management? Select all that apply. A. Gently massage the client's legs to avoid cramping. B. Encourage holding a pillow against the surgical site. C. Limit visitors to promote proper resting and healing. D. Put a favorite television show on while the client is out of bed. Correct answer: both B and D. Splinting the surgical site with a pillow or towel can help reduce pain and provide the client with comfort, decreasing anxiety. Therefore, the nurse encourages using a pillow against the surgical site during position changes and coughing exercises. The nurse utilizes distraction as an additional intervention for pain reduction. Putting the client's favorite television show on while the client is out of bed is a method of distraction. Distraction is one of the most common additional methods used for pain reduction. Answer A is incorrect. Gentle massage over joints and the back are appropriate interventions. However, the nurse avoids massaging the client's legs because of the possibility of dislodging a blood clot in the legs, which can then travel to the lungs and result in a pulmonary embolism. Answer C is incorrect. The nurse only limits visitors during visiting hours if the client requests this. Visitors are another method of distraction and can be helpful in pain reduction. In addition, the nurse encourages the family to visit for educational opportunities, especially if they are involved in the client's care. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.